Hi, this is Erin Wilkos. I'm going to be talking to you today about medical terminology. Um, the presented case is Don Smith with his date of birth is 7/1/1985. He's the unrestrained driver involved in an MVA or motor vehicle accident. His chief complaint is pain in the left lower quadrant of his abdomen, his left arm, left leg, and a wound to his head. He denies any loss of consciousness or dizziness. His vital signs are as follows. Blood pressure is 165/84. His pulse is 108. His respiratory rate is 24, and his temperature is 96.8. And his sats are 98 on room air. He's got a splint to the left leg, a sling to the left arm, and a bandage around his head with active bleeding. His for the integumentary system, the findings are a cut noted to the forehead with a bump 2 centimeters to the right, bruising noted on the left elbow, discoloration on the left abdomen, and discoloration on the left leg with swelling. Treatments could include everything from cauterizing the bleeding from the head and to suture the wound closed, monitor the bruising, an x-ray of the face, leg, elbow to rule out broken bones, antiseptic wash to clean the areas, followed by a course of antibiotics, a CT scan or MRI of the abdomen to rule out internal injuries, and frequent monitoring of blood glucose, pressure sores due to poor healing. Musculoskeletal system, the findings are a possible broken nose or leg or elbow and a possible skull fracture. Treatment, surgery, casting to correct fractures or breaks, PT/OT to help with ADLs, gait training once healed, electromyography to determine if muscle damage or if muscles are involved, or kinesiology to determine movement difficulties, frequent neural checks to monitor signs of increased intracranial pressure, and reflex checks to monitor sensation and reactions. For the cardiovascular system, his initial blood pressure is elevated, so we obviously want to do frequent blood pressure checks, monitor his vital signs and glucose since he is diabetic. Treatment could include things like an EKG to rule out cardiac issues, monitor wound healing due to the history of hypertension, hyperlipidemia, and type 1 diabetes. IV fluids to help prevent kidney stones, but with frequent monitoring to prevent fluid overload, and consult with a cardiologist. The digestive system, the findings are discoloration to the left lower quadrant of the abdomen. Treatment is an ultrasound of the abdomen to rule out injuries and look for bleeding. Continue the patient's current medicine protocol for GERD or reflux. Monitor signs and symptoms of dyspepsia or dysphagia. Continue performing a lower GI series exploratory laparotomy to rule out internal injuries and consult with a gastroenterologist. Reproductive, there's really not anything. The patient does have a history of kidney stones, and he's got pain to the left side of the abdomen. The treatment would be pain control, hydration, possibly an ultrasound of the testes to rule out injury, blood work to monitor renal function, consult with a urologist, and possibly a urinalysis to monitor hydration status. For the nervous system, findings are the open head wound with bleeding and the bump 2 centimeters away from the wound. Treatments are to close the wound, monitor signs and symptoms of increased intracranial pressure, monitor for signs and symptoms of concussion or a head injury, maintain spinal precautions until cleared, MRI to rule out possible subdural hematoma, and consult with a neurologist. Last but not least, the emotional health. The patient has a history of anxiety and depression. The only two treatments are continue with his current medical regime and consult with a psychiatrist or psychologist to monitor his current condition and add antidepressants or anti-anxiety medications if indicated. And that is all that I have. Thank you.